What if the most advanced medical mind in human history was available to every person on Earth at any hour in any language for almost no cost? What if that mind never forgot a case, never misread a scan, never made the kind of error that kills 400,000 Americans every single year? What if that mind wasn't a mind at all? What if it was a machine? You know, the story of what happens when AI doesn't just assist medicine, what happens when it becomes medicine, and it is a story that is already being written right now in laboratories and hospitals and server farms across the world. The only question is how it ends. To understand where we are going, we need to understand where we already are. Because most people think AI in healthcare is a future conversation. It is not. It is a 2026 conversation. It is happening today, and it is moving faster than almost anyone outside of a research lab realizes. Right. Google's DeepMind built an AI that can detect over 50 different eye diseases from a single retinal scan with accuracy that rivals the world's best ophthalmologists, not matches, rivals. In radiology, AI systems are reading mammograms and CT scans and MRIs and finding things that trained human radiologists missed. Not occasionally, consistently. In one landmark study, an AI detected breast cancer in mammograms with 11.5% fewer false positives and 9.4% fewer false negatives than a panel of radiologists. Those aren't just statistics, those are people who would have been sent home with a clean bill of health. Those are lives. In 2023, an AI system called MedPalm 2, built by Google, sat the United States medical licensing exam. The exam that every human doctor must pass before they are allowed to practice medicine. MedPalm 2 scored 86.5%. The passing threshold is 60%. It didn't spend 4 years in medical school. It didn't do a residency. It didn't sacrifice its 20s and 30s to master a discipline. It trained on data, and then it knew, and that should stop you for a moment, because what it means is that the knowledge gap between a human doctor and a machine is already closing. In some areas, it has already closed. The question is no longer whether AI can practice medicine. The question is whether we are ready for what comes next. Let's go to 2030, 4 years from now. On the surface, medicine still looks familiar. There are still hospitals, there are still doctors, there are still waiting rooms with outdated magazines and fluorescent lighting that makes everyone look slightly unwell. But underneath the surface, everything has changed. Or your doctor walks into the room and AI has already done something remarkable. It has read your entire medical history, every blood test, every prescription, every scan you have ever had. It has cross-referenced your genetic profile with 500 million patient outcomes. It has flagged a pattern in your recent blood work that no human would have caught, because no human can hold that much information simultaneously, and it has already drafted a treatment recommendation that your doctor will review, modify if necessary, and present to you as their own clinical judgment. This is not the doctor being replaced, this is the doctor being augmented, made sharper, made faster, made better. In surgery, the Da Vinci surgical system and its descendants are performing minimally invasive procedures with a level of precision the human hand cannot physically achieve. By 2030, these systems will be partially autonomous. The robot will begin the procedure, it will make the first incisions, it will navigate anatomy it has seen 10 million times in training, and a human surgeon, possibly in another room, possibly in another city, will supervise, intervene if necessary, and sign off on the outcome. This is not science fiction. The regulatory frameworks for this are already being written. Or in medical education, students in 2030 won't just read about rare diseases in textbooks. They will train on AI simulations of conditions so rare that most physicians will never encounter them in their entire careers. They will practice surgical procedures thousands of times in virtual environments before they ever hold a real scalpel. They will graduate knowing more, having practiced more than any generation of doctors before them, and they will still be slower, less accurate, and more error-prone than the systems they work alongside. Somewhere in the world right now, a patient is dying, not because the surgery was too complex, not because the disease was too rare, but because the nearest doctor was 4 hours away, because the hospital was understaffed, because the system, the one we built over centuries, simply could not reach them in time. Now ask yourself this, what if that never had to happen again? What